diabetes is pretty much a pandemic. Is that the right word? Pandemic? Epidemic.
Epidemic,
Maybe.
I think is the one.
Epidemic in this country.
Yep.
And I think.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Welcome back to another installment of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Michael Squires.
Diabetes is obviously a growing concern here in the United States, and it can also be linked to hearing loss. Written by Dr. Madeline Henry of Link Audiology, today we'll discuss how diabetes in certain cases can increase the chances of hearing loss in patients. So, Dr. Michael, I know that, diabetes is pretty much a pandemic. Is that the right word? Pandemic? Epidemic.
Epidemic,
Maybe.
I think is the one.
Epidemic in this country.
Yep.
And I think the more we learn about hearing loss, the more we know how other issues, ailments can help contribute to it, if not cause it. And so it might not come as a stretch to a lot of people that diabetes could be linked to hearing loss too.
Yep, absolutely. And so in order to really understand how diabetes affects hearing, I'm gonna break it down from an anatomical perspective. Okay. So I'm going to ask everybody to just put your seatbelts on and go on this ride with me.
Love it.
It's what I do with my students in my practice and students that I teach is I always tell them that if you understand it from an anatomical perspective, then everything's a little bit more global. You kind of understand it foundation up.
Okay.
So let's talk about how hearing works, right? We got sound waves. They vibrate the eardrum. They vibrate the little bones that we learn about in the 4th grade, the ossicles, and then that is going to act as a piston and go in and out of the cochlea.
Okay.
The cochlea is a little snail shaped. If everybody that's watching us right now, pull up in another tab.
Yeah.
Definitely don't get off of this video.
Never.
Pull open a new tab. And I want you to look up cochlear anatomy, and you'll see what I'm talking about.
It really does just look like a snail shell.
Yeah, it's a snail shell or an ice cream cone.
Yep.
It's got 2 1/4 turns, and within those 2 1/4 turns, there are 3 chambers, and in the middle chamber, which is called the scala media, is found all of the magic. Okay. So that's where all of the cells that are responsible for hearing are found, and so there are inner hair cells and outer hair cells. Okay. OHC, IHC is what we refer to. And there's thousands of them. There's about 3,500 inner hair cells in each cochlea. There's about 12 to 15,000 outer hair cells. And if your hair cells are working, then you're hearing normally. If the hair cells are damaged or dead, then you're not hearing normally.
Got it.
The outer hair cells work as a little amplifier so that they can make the sound signal loud enough for the inner hair cells to hear. If your outer hair cells are damaged, then we have to amplify the sound with a hearing aid or something similar to that to get the sound into the inner hair cells. If the inner hair cells are dead, we don't understand.
Okay.
Right? So we're
still learning how to properly correct that if possible.
Correct.
Okay.
Yeah. And there's a lot of research and science going into it. We're just not quite there yet. The only thing that is there to treat sensorineural hearing loss in the medical community right now is our hearing aids, cochlear implants, and the such.
Got it.
Now, let's take a step back. That whole system is bathed in a very specific fluid called endolymph. Okay? Endolymph.
Okay.
Right? The endolymph has a very specific ionic composition. Okay? So the ionic composition is managed by one organ only, and that is called the stria vascularis. Okay? By name alone, we should understand that this stria vascularis is highly vascular, and it is highly influenced by blood flow. So what I tell patients who ask, and I always ask, do you have a history of cardiovascular issues? Do you have a history of diabetes? Is it well controlled? Is it well managed? How are you managing it? Who is managing it for you? And the reason I ask is because anything that affects capillary blood flow has the potential to affect your hearing. Okay.
Yep.
So namely, in response to this topic, diabetes and cardiovascular issues.
Yep.
So anything that can affect the blood flow to the stria vascularis then will affect the stria vascularis's ability to properly control the ionic composition of the endolymph.
Yep.
And if if those hair cells don't live in that perfect environment, they will start to die.
Got it.
Right?
Yep.
So we see a higher prevalence of hearing loss in patients with diabetes, cardiovascular issues, and things like that. Not only do we see a higher prevalence of hearing loss, but we also see a higher prevalence of vestibular disorders as well.
Well, that makes sense.
Balance disorders.
Totally.
Right? Happens in the same place.
So when we think about diabetes, obviously, I think people have like anecdotal information about diabetes.
Sure.
But when we get into like the granularity of it all, it is stuff exactly like this where, yeah, you need to be able to control your blood sugar just so you don't pass out and die. Right. But if you're living with diabetes, you need to be able to monitor this because maybe you don't have the most severe response to diabetes, which could ultimately be death. But like now we're really walking the tightrope of how severe is your hearing loss going to be?
So, okay. So let's take a quick little break here and talk about the diabetes. Yep. So what we know about diabetes is just like you're saying, as we eat food, our body, turns that into its, foundational components, one of those being sugars. They release the sugars into the bloodstream, and then our pancreas releases insulin to control the blood sugar, right? And in certain types of diabetes, that's unmanaged, right? So we've got type 1, type 2, and I'm not going to go too deep into that. Read the article. It's fantastic, and it does a good job of breaking those down. But let's say a patient tells me that it's managed, but to them, managed means I'm not passing out. I'm not in the emergency room, right? I'm not constantly in my doctor's offices. But that can also mean that we're seeing these big wide swings in blood sugar. Yeah. And so these big wide swings are at some point going to affect the hearing, right? The strivascularis is again ability to monitor the ionic composition of that space in the scala media and yada yada. So over the long term, we have to be really, really vigilant. And this is a case where I really like to see pre and post. I really like to see serial audiograms or hearing tests so that we can monitor the progression of anything. I've seen patients. I have a great case. If you've got a couple minutes, I'll just kind of.
We have a couple minutes. We're not going anywhere.
Fantastic. So I have a patient who was really proactive. Wonderful patient. Love her to death. She comes in and says, I've noticed some changes. I have uncontrolled diabetes. I have a really difficult time controlling it. I'm on medication. I take insulin. I manage my diet. I still get these wide swings, and it's really starting to affect other things. Yeah. So she is very vigilant about getting annual hearing tests, annual vision tests, and making sure that like clockwork, she is seeing it. Yeah. And what we've been able to do is start in the beginning where she had normal hearing at our first evaluation. Yeah. But we will run other tests like distortion product otoacoustic emissions, which is testing the health of the inner ear and the cells that are responsible for hearing, those inner and outer hair cells that we're talking about, or outer hair cells in this regard. But we can see, okay, on the audiogram, we have normal hearing, but we're starting to see a degradation in the hair cells response in those distortion product otoacoustic emissions. So it's kind of a little bit of foreshadowing. Yeah. The next audiogram, we see a little dip. The next audiogram, we see a little bit more of a dip. So, then we have to sit down and say, at what point do we start really considering now we need to treat the hearing loss? Yeah. Because it's inevitable at this point that there's going to be some progression for this patient. And so we want to be proactive in also treating the hearing loss so that we don't end up with auditory deprivation or some type of an issue with like in what we talked about in other podcasts, is waiting 7 to 10 years to treat the hearing loss when it's discovered. And this particular patient does a really nice job of saying, I want to be proactive in treating all of these issues because I don't want to end up with difficulty with communicating and hearing.
And maybe that's the takeaway is if you are diagnosed with diabetes and you are now on treatment, whatever that looks like for you for diabetes, maybe one of the next best things is to go to an optometrist or to go to an audiologist to now set that threshold of where you're at today, so you can better understand where you're at in 3 months, 6 months, a year, so moving so forth, so that you aren't going to be caught off guard by potential hearing loss.
Yeah, and I guess the takeaway from this side of the table would be, if you have diabetes, controlled, uncontrolled, speak to your managing physician, whether whether that's your primary care or whatever the case might be. Speak to your managing physician about the things that you should be taking a look at.
Yeah.
Ask them about hearing, ask them about vision, and make sure that you incorporate those baseline tests and serial audiograms or serial hearing tests as part of your annual physical, so that you really have something to compare it to, and you can be proactive in treating a hearing loss or a vestibular disorder if it occurs.
And now that you've been told to eat healthy and eat clean for the billionth time in your life, grab a salad and sit on down with your laptop, and feel free to navigate yourself to Ask an Audiologist for hundreds of other audiology-related articles. Exceptional job, Dr. Michael.
Hey, thanks, Kevin. You too.
Thank you so much. We'll see you guys next week.
All right, take it easy.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
Of the millions of people that are going to watch this episode, there's going to be a significant portion of people who experience tinnitus.
Yeah.
And I know that some of the stuff we're going to talk about today could help them.